Hey everyone, I'm Nick Lees and welcome to Digital Health on Air. I am Luma's Head of Information Security and Compliance, and I'm joined today by fellow healthcare information security expert, Brent Williams. Hey Brent, thanks for joining us today. We're going to be discussing the growing importance of information security and its role in healthcare delivery. So Brent, welcome. Thanks again for joining us today. To kick us off, do you want to give us a little bit about your background in InfoSec?
Yeah, for sure. Thanks. And thanks for having me here today, Nick. Appreciate it. It's great to sit down with you and talk through this. So for me, a little bit about me. I've been around for a little while. Started in security in the late 90s, early 2000s. So roughly a little over 20 years I've been in it. And back then it was really just the security was one of those other things you did as a sysadmin or a network administrator. But I really started to take a liking to it because it was one of those continuous learning things. And then I had an opportunity to go back to school and study under my mentor and get my master's degree and really dig in, which, I learned a ton about just the breadth of information security and how it could help businesses really secure their information because we were in that digital transformation. Then had the opportunity to work at Accenture and really see security at scale on a global level for a bunch of different information sources like healthcare and like payment card data, things of that nature. And then over the past few years or decade or so, I've had the opportunity to work in Silicon Valley, work in the Intel community, and really just see security at all different levels, the nation state actors, the script kiddies, you name it. So been really fortunate over my career to have all those opportunities and really just, looking to put it to good use and put the good word out there.
Perfect. Yeah, I mean, I've been in kind of infrastructure engineering and security for, it's probably approaching 20 years now. So I feel pretty old myself, but definitely seen like a lot of changes in that time, as I'm sure you can relate to as well. We're not kind of looking at the people in the basement anymore, just like hacking for a little bit of fun. And as you said, like mentioning nation state actors, we've really changed into this has become an organized crime problem now as well. So everyone's got to really be on their guard. So, I mean, kind of moving on from that, we've seen a real boom kind of in discussions about healthcare infosec for probably about a decade now. So do you want to talk a little bit about that shift maybe?
Yeah. So, in preparing for this and just thinking about these topics, I really started to dig in and think like, what is it about healthcare that's so unique? I think one, it's a target-rich environment. You think about the data sets that are out there and what people can do once they have those data sets. It's just really powerful in terms of stealing identities and maybe going and getting credit cards or financial. It's just what it leads to, right? It's an entry point. And so I started thinking, well, why this area? And I think it's been behind for a while. And I'm not really sure why, but one anecdote I know is that a lot of hospitals, a lot of healthcare organizations are physician owned and managed, and they know the healthcare space very well. But what I don't think they've done a good job of is keeping up with the technology. And we're moving to digital records, or we're actually there, and how that's going to impact their businesses, how it's going to impact their patients. And so I think over the last 10 years or so, cyber criminals definitely noticed it. It's not, like you said, the script kiddie or the curious researcher in their parents' basement, but it's the enterprising criminal organizations that are stealing data in mass to do just that, to either resell it or to monetize it in some way. And so I think the hospitals or just the healthcare industry in general are finally seeing like, oh, we have this digital aspect to our business that we must protect. We should protect this like we protect our patients. And so I think you're really starting to see a focus on that. And I know there have been quite a few high profile breaches as of late, which I'm sure you're reading about those all the time. You're very well in tune to those. But I do think we are starting to see the industry step up their game. And just as a quick example, one of my healthcare providers, they probably about a year ago, they instituted mandatory multi-factor authentication in order to get into my information, which is great. They were using information that they had on file and forced me to use that to enroll. And if the enrollment failed, I would have to go in person and finish the enrollment. And I think that's great. I applaud that sort of thing. However, I do wonder, what is that doing to the generation that aren't digital natives and like us that didn't grow up with technology in their hand? Like, it's a little difficult. So interested in what you're seeing.
Yeah, I mean, it's funny because almost like the role of like everyone on the planet, almost when you think of infosec, is changing, and kind of like relating that back to healthcare as well. It's like kind of like you said about the small physician's office, like they're having to focus on like not just patient care, but now like the security of all their patients' data as well. And there's that minefield of like, well, what should we be doing? What advice should we follow? What technologies should we be using to protect ourselves and protect our patients? There's just a whole other element that now needs to be considered.
Yeah. Yeah. And we had this really big event that I think everybody on this webinar experienced a handful of years ago, the COVID pandemic. And so I know I wasn't in the healthcare space at the time, but from a technology company perspective, it totally changed the way we were thinking about securing information and how people work and how we get their access to information. We had been saying the perimeter's gone for a long time, and it almost felt like overnight the perimeter was gone, right? And so people went home with their laptops and never came back into the office. So we had to do a variety of things to secure that information. I'm curious, how Luma kind of dealt with that and how you saw some of your customers and they'll deal with that.
Right. I mean, yeah, kind of like pre-pandemic, we were predominantly, like in-office organizations. So,
Mm,
like physical footprint in downtown San Francisco. We did have some hybrid workforce, but, typically your traditional 9 to 5 in the office. Then all of a sudden, overnight, like everyone else, right, it's like, well, we're working from home now. Like, how do we handle this? Like traditionally, our network perimeter, it was the four walls of our office. We're firewalled and things like that. That's all we have to think about. And now it's like, well, the perimeter is not our office anymore. It's literally our workforce's individual laptops. So, what are we doing to make those secure, right? And that's one part of it. Then, you've got infrastructure that previously you only allowed access to through your office, and now your
mhm.
workforce is completely distributed. How do you potentially like open these endpoints and devices up and these services up to employees while at the same time keeping them secure? So yeah, I mean, security is definitely a complex thing, but it shouldn't be something that only a few people focus on as well. So it's definitely like a company. Well, it has to be a company-wide initiative.
Yeah, and the term I like to use, and this as a former auditor, is business as usual, right? Security, when it's done well, should just be part of the fabric of your processes, your technology, your business. People shouldn't know, oh, I have to do this security thing. It's just, oh, this is the way I log on. This is the way I report this weird email. This is just how I operate in this environment. And I found that to be very effective. And when you create that low friction, it just seems to work. Whereas the high friction things, remember old school like VPNs where you just had
Right.
to go through a variety of things. Oh, I got to select this profile. I got to when it's hard, people are going to find a way around it, right? And
Right.
so I think it's just uber important to make it just business as usual.
Yeah, I'm glad you brought that up. Like, the high, low friction thing, because, my kind of like mentality towards InfoSec has always been it's something essential, but it should enable, your workforce to be more effective. It isn't, it's not there to put like guardrails and, well, it is there to put guardrails in the way, but it's not there to like introduce blockers for your staff and introduce frustration and
Mhm.
slow people down and kind of like stifle productivity and innovation, because to your point, that's when people are going to start finding a way around it. So, like, I don't want to use the VPN. I don't have to if I do it this way. So I'm just going to do it that way because it's easier. So,
Yeah, and I've been working on this pitch for years about how to how does security enable the business? And where I've landed is it's really, I look at security as we set up the guardrails, if you will, to allow the business to go as fast as it wants to go within those parameters, right? So security's not in the way, it's on the sides, keeping the business like this way or that way so that it's focused and can move really quickly.
Yeah, and I think
Yeah, go ahead. Sorry.
yeah, I was going to say a key probably balance for that as well is like a nice mix of, traditional technical controls backed up with like very strong like workforce education program as well. So
Yeah. And what I've listened to many of these webinars, and I've just been out there digging like, man, what's the secret? What's going to make us successful as a security organization? And it's kind of underwhelming, but it's kind of reassuring that it's the basics.
yeah,
It's user access management, it's patching vulnerabilities, it's having just a good, solid program across all aspects, and then constantly assessing over and over and over again your process, your technology, right? From a technology perspective, things have moved so fast over the last 5 to 7 years, um, that if you're running the same technology now that you were back then for, say, anti-malware, you should probably reassess that. So it just that's why I come back to, like, once the team we've completed this project, right? We've implemented this multi-factor thing. Cool. Let's go back and review it. What are the gaps? Because we probably didn't nail it 100%, but what are the gaps? How can we be better? Let's mark those down. When the contract renews for a certain vendor, let's look at the space. Let's see who are the players in space. What are they offering? Do they cover these gaps that we have? If not, let's get closer to our existing vendor, or let's look to move. So yeah, but again, I really think it's about the basics and really understanding your environment well.
yeah, and I think just to kind of like lead on that a little bit, like that kind of brings in nicely the importance of having a strong security compliance program as well. Because if you're chasing and maintaining certifications like a high trust or something, they're releasing new versions all the time every year, so you need to stay on top of it to recertify. And I feel like that kind of drives, the thought process and of continuous improvement. It's not like you can't just say it's like, oh, we've got antivirus or an EDR solution, but yeah, we installed it 7 years ago. That's not going to cut it with next year's high trust, right? So we always need to be thinking like the next step ahead. So that's one of the reasons I'm a big fan of high trust. ISO as well, it's not as strong as high trust in some respects, but still like, a great framework and foundation for a strong security program.
Yeah, and we talk about the basics and a strong security program,
Yeah.
and having buy-in. And as security leaders, we want leadership to be bought in and supporting us. We want all the employee base. Maybe they don't agree, but they buy in, right? So it's disagree but commit and go along this route with us. And I just saw something the other day. Microsoft took a huge step. This is the first time I've ever seen this in our industry, or in any industry for that matter, is they're tying success of security to executive compensation. So, Microsoft's had a handful of high profile hacks over the last couple of years. They said enough. It starts at the top. If you want your bonuses and that sort of thing, you need to secure your organization. I have no doubt that will drive change.
Yeah, definitely. And the tone for the top is so important. Like, you might have a security team at your organization. We have a 4-person security team here at Luma, but really everyone is security, and it's everyone's responsibility to keep, our data safe and our patients' data safe. So yeah, interesting move from Microsoft, but I definitely agree with you. I think that's gonna see results for sure.
Yeah, and you just said something that made me think about the basics and everyone's responsibility. An example is basics are, you need to know what you have out there in your environment in order to protect it. And one example I've seen is, younger companies that are they want to move fast. Startups, we'll say.
Yeah.
They have a lot of smart people and they want to move fast. So you tend to have teams will stand up their own infrastructure, and they may stand up some infrastructure, some portion that isn't known to the security team, or it's outside the scope of what your current footprint or tools are. And so, um, it's just, again, super important for everybody to understand, like, hey, these are the rules of the road. This is how we play. And so if we have an asset out there, let's bring it into scope so we can at least monitor, manage, maintain it. Again, basics.
Yeah. And and it's getting people out of that mindset. It's like, well, I'm just going to spin up this resource here to do this small job for me. It's not production or anything, so I don't need to worry about telling the security team, it doesn't need EDR or anything. But it's like, you need to be in that mindset. It's like, well, it's an asset, a device that's on our network, so automatically it has some kind of interface back to everything else that's on our network. So it needs to be secured like everything else on our network is. And if you don't know that device is there, then how can you secure it? So yeah.
Yeah. One thing I've been wondering about, we haven't had a chance to catch up since this happened, is the Change Healthcare hack. Like,
Yeah.
how are you thinking about that? Like, what's on your mind now that we know a little bit more about what happened there?
I mean, one thing that's been kind of really interesting to me about the Change Healthcare situation is, organizations that have been affected, like directly or indirectly because of this, and partly because they didn't realize they had some kind of dependency, reliance, connection, or integration back to Change Healthcare. So they didn't realize Change were doing something perhaps small or specific for them until they couldn't do that one thing anymore. I mean, and that to me, I guess, really highlights the need for, a very strong or mature, like, risk management program, like, throughout your supply chain, right? You need to know, like, what software we're using, what services are we using for third parties, and, what is it that they're doing for us, and what data are we exchanging with them,
Yeah, absolutely. I mean, like with the here at Primer, we have SOC 2, and one of the main SOC 2 premises is understand your vendor criticality, and then, what are the contingencies for that? And so that's kind of what I would think when I hear that, is like, oh, I'm connected to this vendor, but I didn't know it. Again, basics. What are you connecting to?
Right.
Right? You should probably know that. Hey, we're connected to the internet. You know that. You're securing that. So you should probably know all your vendors and your other connections.
Yeah, and that kind of goes back to kind of the tone in the top, and security is everyone's job as well. Like, it's your employee base needs to know, like, from the top, that's like, hey, before you engage with another vendor to do something for us, before you purchase another piece of software, your security team need to know about this, or your GRC team, they need to know about this, so they can make sure we're assessing this vendor, right? To make sure they've got, like, not only good, like, security and privacy controls in place, and, they've been vetted but independently to make sure they're operating effectively as well. And then that needs to be an ongoing basis. They might be good in, like, 2023. Are they still good in 2024? It's so important.
Yeah, definitely. I think I was trying to catch up on news this morning. There's so many breaches and things like that. I don't know. I can't keep up. But did I see that there was another high profile breach in the healthcare space, Ascension or something like that?
Yeah, Ascension. Yeah.
Do you have any details around that, or any thoughts on that one?
Yeah, haven't had the time, to it's still new to me to dig into it too much. So, but always try and stay on top of these kind of things. What's good for me is to, like, kind of like, when a breach like this happens, is to kind of follow it all the way through to the end of its life cycle, so you can see, like, the root cause analysis at the end, and then, like, digest that and think, hey, their weak points were here. Like, have we got any similar weak points maybe? And then,
Nice.
my team can be tasked with, like, hey, let's take a look at these things. Have we got a similar weakness here that we've not thought about? Let's think about and make sure that we haven't.
Oh, nice. A little replay attack there, huh?
Yeah.
Sorry, that's a little security humor. Nice.
I like it. Yeah. So, but yeah,
Wow.
it's almost so commonplace it becomes white noise at some point, doesn't it? So it's
Yeah.
scary world out there.
Right. And so, again, it's like, how many times can we read about, oh, there was this VPN endpoint or this login page that wasn't protected by multi-factor, and then it just got hammered with a brute force attack, and then somebody logged in. So yeah, I mean, after a while, that's why I say it's the basics, because it's just over and over and over. It's the same kind of weaknesses that are leading
Yeah.
to a lot of these breaches, and so nothing really new. Yeah.
Yeah. So the key takeaway, I guess, Brent, is, InfoSec, it can feel complex and even scary, right? Especially in healthcare when PHI is involved, potentially hundreds or hundreds of thousands of records. And it doesn't matter how complex things get, right? It's the basics that are the most important.
Yeah, definitely. Any other like tips or just foundations that you follow when you drive throughout the team and the rest of try to get across the rest of the organization or your customers? Because I know you talk to customers a lot.
Yeah, get it. So to the same point, know your inventory. So know all your devices, know where they are, know what they're doing, make sure they're all secured. Then thinking about other corporate security on your devices, make sure you know about all of your employees' devices, make sure they're centrally managed, make sure they're protected by some kind of next generation antivirus or EDR, make sure they're regular patched. And then key is education as well. Like, it doesn't matter like how strong your technical controls are, it's still easy for someone to make a simple mistake. So, and we've always kind of like really socialized that with everyone at Luma as well. It's like, hey, if anything doesn't feel right or you're not sure about anything, just take a step back and ask a question, and we can make sure it's on the up and up or it's not. So
Yeah, I agree with you. And what I would add to that is something I've noticed, especially with teams that have been there for a while, is we start to get like a bias that, oh yeah, this is working well. So I'm a huge fan of bringing in once a year, once every 18 months, you bring in a vendor to do an assessment. Like I know we all have our ISO 27001 audits and SOC 2 audits, but bringing in a vendor to look at your operations against, say, the NIST cybersecurity framework or something, and or having a vendor conduct an incident response tabletop for you. I've had a couple vendors, and I'm happy to share those, later on, that they've done excellent jobs of running those and highlighting issues that if you were to go and look at our internal assessments, we're like, oh yeah, we're good. Well, guess what? When you have that unbiased eye looking, it's like, actually, you got a lot of places to tighten up. So I think it's the basics plus having some unbiased third party come in and help you look at your basics every once in a while. So.
great, solid advice. Well, Brent, thanks again for joining us today. This has been a great and very timely discussion. So thanks everyone for joining us on Digital Health on Air, and we'll see you again soon.
Thanks. See you. Cheers.
Thanks.